Hello everyone, I'm Dr. Divya Sharma. I'm a dermatologist with special interest in pediatric dermatology and trichology. I am practicing in AECS layout 60 feet road and in the area of Brookfield since past 6 years. While discussing the management of atopic dermatitis, I would emphasize prevention first. It's very important to moisturize the child during a flare using a good moisturizer. Now, a good moisturizer would be a pH balanced, parabens and fragrance free Syndet possibly, which is free of soap. Number 2, we should minimize the bathing and washing. Number 3, it's very important during these days when the child is suffering from a flare to keep his ambient environment a little humid. So you can use a humidifier, or you can use probably somewhere where the child cannot approach or tamper with. You can put a hot vessel with steaming water that would sort of humidify his immediate environment. Coming to the treatment aspect of it, immunosuppressants play a major role in treatment of atopic dermatitis because, as I said, it's a chronic inflammatory disorders. So generally the itching doesn't get resolved by the over-the-counter anti-allergic syrups. They would require something that pacifies the immune cells that are attacking the skin during a flare. So if we talk of the first line management, that would always include, apart from your moisturizer, or what we call as emollient. Emollients also try to preserve the moisture and prevent the transepidermal water loss. First line management would include topical steroids that should be used for a minimum period of time. We should not abuse it. We should not use it for more than 2 to 3 weeks, and it should always be done under supervision of a dermatologist. And number 2 is topical calcineurin inhibitors. They form an interesting non-steroidal option because atopic children are predisposed to repeated flares. So they would require a non-steroidal option for the maintenance. So I would rather put more emphasis on these calcineurin inhibitors like tacrolimus and pimecrolimus depending on the age of the baby to maintain the results. Of course, if the child is not responding to the topical treatment, we would have to go for oral options for a shorter period of time. Like the options are, again, oral steroids are given for a very brief period of time, and parents are generally very scared when we mention the word steroids. But the fact is that an atopic child does need an immunosuppressant, especially during the acute phase of the flare, to calm it down. It should not be used for beyond more than 3 weeks. It should not be used indiscriminately. Steroids should not be used more than once a day. Please consult your dermatologist before opting for even topical steroid. Coming to oral steroids, one would prefer to give a short course of steroids in cases refractory to topical treatment. Other immunosuppressants like cyclosporine have also been tried to varying success. There is another option known as phototherapy for recalcitrant cases and in cases where we cannot give an oral immunosuppressant. Or most of the times, patients have this fear of giving steroids to their child. So in that case, narrowband phototherapy, in an older child would also be an option to reckon with.